This isn't about the brain function. In fact, this is about eventually letting the brain stop thinking. Eventually. Gaps in thought, where you sit in this state of just harmonic sense. And so that state of that symphony I've termed, for lack of a better term, harmonic resonance. So it's a resonant state of harmonic vibrations that's occurring in the natural world all the time, and we just don't experience it. So the idea is that as you follow your breathing, you follow it deeper and deeper and deeper and deeper and deeper into this state of surrendering. Again, the idea of surrender is very important because, for my mind, the seed of anxiety always comes from the need to be in control, or the perception that you have to be in control. And the more you feel like control is being taken from you, the more anxious you become. And so that idea that I need to, or the perception that I have to be in some kind of controlled state, is a very deep psychological need or attachment. And in the meditative state, you can control your breathing. You can breathe fast. It's a voluntary activity, but it happens all on its own. So the ability to let it happen on its own and not exercise control is the way you surrender, by letting go. Now your mind will say, I'm not breathing enough. Am I breathing too much? What's happening to me? The mind it doesn't matter. Your body does this. You don't have to think about it. And that ability then, as you develop it, you stop thinking for periods of time. And the obsessive compulsive thinking disorder that we all have to greater or lesser degrees starts to dissipate slightly. Now apply that to someone with a drug and alcohol problem, or apply that to someone with anxiety and depression. You can instruct them that it is a part of their treatment program to learn impulse control and frustration tolerance. And as you meditate, that's exactly what you're doing. You're putting yourself in this contradistinction to your experience and to yourself. So this idea that consciousness sits all on its own, everything comes into your consciousness. Bathing in that conscious state with no thought, profound transformation. And it is absolutely, fantastically sensed. And the two things, I'll finish with the two things about meditation that I would leave you with. The first is that you cannot do it wrong. This isn't like I had one of my patients who is getting more and more into meditation as we talk, and he said, I always feel like I'm just snorkeling. I'm really not getting deep. You're just snorkeling. The fact is that is his meditation. That's where he's starting from. So, his concern about whether he's snorkeling or anything, that's pointless. You do this without expectation because you cannot do it wrong, other than just not practicing. And the second thing is there is a natural gravitational pull, physiologic pull, to being in this state. And as you practice, you're driven gradually, slowly, inextricably toward this state of rhythmic being, where things are just happening without anyone at the control, without anyone trying to determine whether my sodium and potassium are coming in and out of my cells, and etc. So that's basically the short story of meditation and how I think that it applies to Sovereign and the program that we have here. And so and we have patients that we're teaching from early phases to start meditation, and the day-to-day life at Sovereign is that the first part of the patient's life is a meditative period of time. And then the last time before dinner is a meditative period of time. And people, have different relationships to what that means. So we're trying to encourage them to grasp or to let go of their concept and just do it.
How long do you recommend them to start this?
It depends on the person. One of my patients, who was a Sovereign patient, who was a 6'3", athletic, very, very energetic guy from, I think, Arkansas or somewhere. Meditation just didn't come into the conversation ever. Says that he can sit for 5 minutes. But after 5 minutes, he has to get up. And I've tried to encourage him that when you have that sensation of having to move, just feel it. Don't move. Let it come. Feel that energy of having to move. It'll dissipate out of you, almost like you're radiating stress. But in general, I recommend 15 minutes. The best, the practicality of meditation is that you want to wake up. So I usually recommend doing this first thing in the morning. So you get up out of bed, you take a shower, you brush your teeth, you get ready for the day, but then you put your pajamas back on and go sit in a comfortable place somewhere in your house that you enjoy, where there won't be many distractions, and just sit. I recommend that you sit something like this. You don't have to be in the lotus position with your arms out or anything. You want as little physical contact as possible. So cross your ankles or fold your legs underneath you if that's comfortable, and then fold one hand inside the other and cross your thumbs with your hands in your lap. You don't want to be lying down when you do this because a lot of times you go to sleep. And the point isn't to go to sleep. The point is to stay awake. It's going to heighten your awareness of things. It doesn't lessen it. You don't go into a state of grogginess or mystical and disconnectedness. You go into a state of heightened awareness of everything around you. And so just to sit there like so, to close your eyes, to take a couple of deep breaths. You want to practice this with me? Sure. Now, let me just explain. Don't cross your fingers like this. And the only reason is there's a lot of touch going on when you do that. Fold your hands one inside the other. You want as little touch as possible. But whatever's comfortable. I have another patient who's quite obese, and she wants to sit with her hands apart. I said, that's fine. Sit with your hands apart. But you don't want your head relaxed back too much. You want your head unsupported, but your back well supported. So, take a deep breath in and close your eyes. And let all your air out. Take a second deep breath in. Hold your breath for a second. I want you to feel how you feel right now. Feel your body. Is there any tension? Let your air out. As you let your air out, let go of that tension.